Assalamualaikum. For you guys, I'm sitting in a place where I'm giving you people a lot of tips about tracheal management. So, tracheal stenosis, which is caused by congenital disease or iatrogenic acquired complications. In congenital disease, there's a lot of pediatric congenital stenosis, which is long in short segments. Some infectious disease which cause tracheal stenosis like histoplasmosis and tuberculosis, and iatrogenic or traumatic. The traumatic one result from the blunt or penetrating injuries. The penetrating injuries mostly occur on the neck sides, while the blunt injuries occur intrathoracic, right sided on the cranium, on the tracheobronchial trees, because their avulsion occur and disruption occur of the trachea. While iatrogenic, which is result from the tracheostomy, if the tracheostomy high between the trachea and cricoid or its result subglottic stenosis, while it is you make a normal tracheostomy but you leave a large aperture or tracheostomy place, but the inflated remain for the longer time, more than 2 to 3 days, and with the low volume and high pressures. So when they inflate the tracheostomy tube, its result 25 or 30 mmHg pressure, but due to ventilation or other intrathoracic, that pressure rise to 200 to 270, which is quite high, and result necrosis of that area, causes compromised blood vessels, and little by little that result fibrosis and granulation tissues occur, which cause stenosis of that region. If the stenosis more than 50% are stenotic aperture, it is 4 to 5 is the result severe restriction with catastrophic uh, emergencies, which need emergency tracheostomy or splanting. Another, low tracheal intubation. Low tracheal intubation, which is on the jugular notch, especially in the children with hyperextended neck or young age, and kyphotic peoples. These result with tracheal injuries. Maybe these injuries result in the tracheoinhumate injuries, which is result in massive bleeding, or tracheoesophageal fistula, which is the communication between the trachea and esophagus, and tracheocutaneous fistula. This can be managed, but which result subcutaneous emphysema, which needs tracheostomy, intubations, and to tracheostomy, and always try to manage immediately to save the life. And other result from the uh, burn injuries, inhalation, smoke and fumes, which result in the mucosal injuries. Later on, after some days, these result in fibrosis, which is cause tracheal malformation. Other other reason which cause the narrowing of the trachea by the medicine tumors, especially gouters and bronchogenic cyst and neoplastic tumors, as well as uh, these tumor, if the gouter tumor is interiorly, will not result in tracheal deformity, but if it's cover laterally and posteriorly, it will result in tracheal deformity, sometimes result in tracheomalacia, which is very bad, in which patient during expiration result in the stridor and barking type cough. So these always need splinting or tracheostomy. So we can avoid all of them, but we need to investigate them. We always investigate with the uh, radiological, non-invasive. So radiological which is x-rays will not tell the clear, but if you remove the tracheostomy, if it more than 48 hour or month or 4, you should remove the tracheostomy to then take the x-ray. And CT scan, which tell you the exact location and other pathologies like inflammation, tumor, whatever. And MRI, which distinguish between the normal abnormalities, normal anatomical variations and abnormalities. While bronchoscopy, which is very bronchoscopy, it is a gold standard which locate it, but always try to do bronchoscopy when you are going to do interventions like surgery, like putting splint. So this is and the treatment, which is the main goal to relieve the restriction, which is by non-invasive, means laser and cryotherapy, brachytherapy. These are have a good result, while splanting is very good options, and always put splint in tracheomalacia, and intermittently, repeatedly do bronchoscopy and uh, lung functional test to assess the competency of that trachea. And after that, we will go for the surgery, which is the tracheal resection and osmosis, but should not be more than 4 centimeter. If it more than 4 centimeters, it will result in the tracheal dehiscensis, recurrence, and more catastrophic uh, results. So this is the all about the trachea. Hopefully this will help you peoples, and you people will get good knowledge about it. Thank you.